Hello, everyone. I see quite a few folks are jumping into from the waiting room, so we'll just give it a brief moment before we get moving on this. Thank you all for being so on time. I'm just going to assume it's because you are all so excited to hear about this topic, which really is an exciting one. The number's still rising, so we'll just wait just one more minute. Hope everyone is staying cool today. It's here on the East Coast, it's starting to get really hot. All right. So I see that we still have some folks coming in, but because we have so much great stuff to discuss today, I want us to get moving forward. So thank you all for joining us for this webinar titled Functional Cure in Hepatitis B. What does it mean for the U.S.? This is being put on by the Hepatitis B Foundation and Hep B United. We're very thrilled to be able to bring this to you today. I will be moderating it. My name is Frank Hood. I use he, him pronouns, and I am the director of Hep B United, which is a coalition put together by the Hepatitis B Foundation and APCHO, the Association of Asian Pacific Community Health Organizations. And we have been around, the foundation's been around for 35 years now. The coalition's been around just about 14 or 15, and we've been primarily HHS and CDC funded, which is thrilling because it shows a great investment into this space. And over that time, we have seen new treatments for hepatitis B, new diagnostics, new vaccinations, but we have never had here in the US a treatment that can achieve a functional cure. And as many of us know from our work in this viral hepatitis space, especially over the last decade, that having a curative treatment can really do a lot for you, as we see on the hepatitis C side. So this is a very exciting time to be able to start this conversation and really just see how it's going to impact positively our work moving forward. So we are using Zoom in a webinar function, so all of our attendees are on mute, but we do ask that you please feel free to say hi to other attendees in the chat. Additionally, we are taking questions for Q&A after our three speakers speak, so please at any point throughout, drop in your questions in either the Q&A or the chat box. And like I said, feel free to drop them in just anytime throughout and we'll handle it at the end. This session is being recorded. We will share that recording by the end of this week, excuse me. And some of the slide decks can be shared, but not all. And if there are things that get asked and we're not able to get answered, we will try to get them answered and posted somewhere after the fact. So if you are, we have quite a few folks joining us today. If you are unfamiliar with Hep B United, I did mention it just a little bit, but here's some more info. We really are a coalition of coalitions connecting folks from across the country with one another so they can tackle hepatitis B in community. And many of our coalition members aren't just focused on hepatitis B, they're actually focused on the overall health of their specific community, which hepatitis B happens to be one of the concerns. So we do a lot of syndemic work where we're working with folks incorporating hepatitis B into blood pressure screening or HIV screening or other infectious disease work. So really coming at it from all doors and windows. Our three speakers today, though, are just the absolute masterclass of folks to talk about this topic, and I'm so excited. The first person we'll hear from is the Foundation's president, Chari Cohen, who will look at what this has meant already and what it could mean moving forward. We are thrilled to be joined by one of our industry partners from GSK, James J.P. Esteban, who's the Senior Medical Director of U.S. Medical Affairs and Hepatology at GSK. And he's going to go and get into the nitty-gritty science of it all and show us some of the data that's been recently released. As someone who's gotten to see through some of this stuff, I gotta say, like, you all should just get hyped about what some of this data shows because it is definitely new. And then we'll close it out with Justin Chen, who is the Population Health Program Coordinator at Charles B. Wang Community Health Center, which is an FQHC in New York that has been doing great work in the hepatitis B space for years. As I said, we are going to do a Q&A at the end, so please do put in your questions as you go. But to get us moving right along, it is my thrill to have Dr. Chari Cohen come on and present. And Dr. Cohen, here are your slides. You are welcome to take it away.
All right. Thank you so much, Frank. And thank you everyone for being here. I'm really excited to talk a little bit about community and lived experience perspectives towards functional cure for hepatitis B. Next slide, please. So we need to know as the treatment pipeline changes and grows, and hopefully more and more and better treatments become available for people with hepatitis B, we really do need to understand what people living with hepatitis B and the communities and caregivers' perspectives are. And we have been working, and I know a lot of other people have been working as well, to try and understand what it means to live with hepatitis B. What are the physical, psychological, and social impacts of living with hepatitis B? What are the health-related quality of life impacts? How do people think about current treatment and future treatment? And ideally, what do people want in terms of future treatment? And what are people willing to go through, right, in order to potentially even have a chance for a functional cure? Next slide, please. And when we talk about how do people think about functional cure, this is very new for us. We don't know a ton, and I'm going to share that. I'm going to start by sharing the idea that we don't know what everybody thinks about functional cure. We don't even know what everybody knows about functional cure. We have just started doing this work a few years ago because before then it wasn't really an option for us. And so now that we know it's an option, we really do need to think about, number one, how well do people understand what functional cure is? How do we improve awareness and understanding of functional cure? And then of course, how do people think about functional cure, especially as it's compared to other therapeutic options? And what are the potential challenges as new treatments come down pike? What are the potential challenges with those regimens? And how do we help overcome challenges to improve access and uptake? Next slide. So we started doing general work in terms of documenting lived experiences back in 2019. The Hep B Foundation hosted the first externally led patient-focused drug development meeting with the FDA in June of 2020. And we supplemented that with quite a bit of quantitative and qualitative data that we have continued to collect over the last 6 years, including surveys, focus groups, interviews, and data mining. And so that's where we are now. I'm going to share a little bit of data related to what we're learning about how people think about functional cure. Next slide. So first I want to define what functional cure is and how we're using that definition in this webinar today. And I took this from the most recent journal article from Gut Liver from Dr. Anna Locke. So undetectable hepatitis B surface antigen and unquantifiable serum hepatitis B DNA for at least 26 weeks after a finite course of therapy. And that is how we're defining functional cure. You see a few things there that are new and different. One is finite course of therapy. So we are not talking about therapy that is indefinite as we know it can be right now with the current antiviral treatments. And number two, we see undetectable surface antigen. So we're going to talk a little bit about why that's a goal, why it might be important. Next slide. We asked people when we did our first community and patient-focused global survey in 2020, we put this definition out there. So loss of surface antigen after treatment, and the treatment is only given for a short, limited amount of time, and that the surface antigen loss and the viral DNA suppression remains even after the treatment ends and long-term liver cancer risk is reduced. And so we kind of defined this and explained it to survey participants. And then we asked them, is the term functional cure appropriate and meaningful to you? And how does it compare to other terms that we might use for it? And you can see here internationally, so outside the US, the top graph where we had about 173 people respond to this question, 78% said yes, functional cure with this definition was a meaningful term to them. The bottom you can see, oh, sorry. So the top is US. I apologize. The bottom is international, so not including the US. This was all the other countries represented. And so 582 people and about 81% said yes. So we can start to see that the term functional cure is something that is meaningful and appropriate for this definition. Next slide. Why is functional cure important? So the next few slides, I'm going to talk about that. And this is some data that the foundation collected along with the FDA. It was an FDA-funded program that we did with the FDA Office of Minority Health and Health Equity, and it was led by Dr. Yasmin Ibrahim. And it looked at the impact of living with hepatitis B. And what we saw from the participants in that study is that 73% felt a physical impact from living with chronic Hep B, 75% felt a social impact, and 25% felt a worry impact. And you can see in the table, we have the percentages of participants who felt challenged, right? And this is all related to quality of life impact and why living with chronic hepatitis B is important and potentially, it's important even outside of clinical indicators, right? Outside of ALT levels, outside of DNA levels, all of this is important to people. Next slide. And then when we asked people in going back to the 2020 survey, how they felt about ideal treatment outcomes, this was basically rank what you want from a future treatment. You can see here, we broke it up into US and international. So here's the US graph. And you can see that looking at the graph on the left, decreased risk of developing liver cancer was the #1 ranked treatment outcome, and loss of surface antigen was #2. Now, if you look at the weighted score, you can actually see that loss of surface antigen beat out risk of developing liver cancer, decreased risk of developing liver cancer, because more people scored loss of surface antigen either as 1 or 2. So you can see here, loss of surface antigen is very important to people. Next slide. This is the same question, except these are the participants who were outside the US. Again, we asked them to rank what their ideal treatment outcomes were, and you can see here, according to the graph on the left, this time loss of surface antigen actually ranked first. It scored highest. But if you look at the weighted, it's actually scored second to being able to stop medication after 6 to 12 months, right? So again, two very important outcomes of functional cure. #1, not having to take indefinite treatment, and #2, loss of surface antigen are critically important to people living with hepatitis B. Next slide. So I'm going to reiterate what I started with, and that is we are just beginning to learn about how people think about functional cure and what the progress and challenges are. But I will say this, finally being able to talk about potentially having functional cure even for a percentage of people with hepatitis B, for us, this is going to be transformative for us and for our communities. It is proof of progress, and that is something that we desperately need to see here in the world of hepatitis B in our space. I also think that having better therapeutic options, more therapeutic options, and potentially even functional cures will lead to more development in the diagnostic space in the US. It will lead to all of a sudden I think we are going to see scale up for testing and treatment in the US. I think it's going to be kind of like a trigger that will increase tremendously, hopefully, scaling up testing, diagnosis, care, and treatment in the US. So the questions we're left with is, what do we need to do now? So this is what the Hepatitis B Foundation is thinking about, and I know what our Hep B United partners are thinking about too. What do we need to get the community ready for functional cure? What do we need to help providers get ready for functional cure? And how are we going to improve access and uptake and make sure that everybody understands what is coming down the pipe like? And I'm going to end with this, and I think for all of us to think about is what is our role, and how can we all help move this forward? And I think that is it for me. I think this was my last slide, just to say thank you, and I am happy to hand it off to the next speaker.
Thank you, Dr. Cohen. Give me just one moment to get us moved around. And with that, I'm going to turn it over to JP Esteban to talk about the drug.
Thank
And
you.
let me you get your slides pulled up, and I'll let you know if I can see
Yes. Oh,
still loading. All right, I can see the slides, but I also see the like preview over to the left.
oh, you see the preview? Let me put it to presenter mode. And
There you go.
oh, did
Oh,
I turn?
now,
I turned it
yeah,
back.
you had it in the middle there.
There we go.
Yay, thank
I
you.
think I got it.
Yep. And
All
just
right.
a reminder for everyone, please put in your Q&A as we are going along, because as soon as the three speakers are done, we'll move right into that. Take it away, JP.
All right. All right. Thank you, Frank. As Frank mentioned, my name is JP Esteban. I'm a senior medical director at GSK. And on behalf of GSK, I'd like to thank Hepatitis B United and the Hep B Foundation for the invitation to speak today. The findings from the B-Well clinical trials or the B-Well studies on bepirovirsen were presented during the European Association for the Study of the Liver annual conference in late May of this year. And the paper was also published at the same time, around the same time at the New England Journal of Medicine. And so today I will be sharing these findings with the group and try to present it in a way that's hopefully very meaningful and easy to understand. So before I get started, I want to share a few things that the purpose of the information I'm sharing today is for um, scientific and not promotional. I also want to remind everyone that the product, as well as the described use of the product, has not been approved by the FDA, and so we cannot draw conclusions about the efficacy or the safety of this product. Today, I'm going to present information for educational purposes. Please don't take this as medical advice. And for any questions and diagnosis, treatment, or decisions about your personal health, please consult a qualified healthcare professional. And lastly, I'd like to mention that GSK, we have no control or influence on any content outside of the specific segment. I want to reassure everyone about that. All right. So for today's talk, these are the learning goals. I hope that at the end of the talk, everyone would be able to understand chronic hepatitis B, how it affects the liver, and current treatment options, define functional cure and what it means for people living with chronic hepatitis B, summarize what bepirovirsen is and how it works in people living with chronic hepatitis B, identify the aim of the BUL studies evaluating bepirovirsen, and recall the B-Well study findings on how bepirovirsen met its endpoints as well as its safety profile. All right, so let's get started with really a quick review of chronic hepatitis B. So hepatitis B is caused by a virus, and this virus infects the liver. Some people, when they get hepatitis B, they are able to clear the virus without treatment. But in others, the viral infection, or the people will continue to have evidence of infection in their blood. And if hepatitis B infection lasts for 6 months or more, we call that chronic hepatitis B. Chronic hepatitis B may cause serious liver damage over time, and this can include scarring of the liver, also known as cirrhosis, liver failure, or liver cancer. So it may help with understanding of the B-Well studies if we cover some of the most common blood tests that are used to evaluate and monitor people living with chronic hepatitis B. ALT, or alanine aminotransferase, is a test of liver inflammation. So when liver cells are inflamed or damaged, ALT leaks into the blood, and this causes the level of ALT in the blood to go up. Hepatitis B DNA, or HBV DNA, is a measure of the amount or number of whole hepatitis B virus in the blood. It is the genetic material of the virus, and it tells us how quickly the virus is multiplying in the body. And lastly, we have hepatitis B surface antigen, or the acronym HBsAg. This is a test that typically determines a person's hepatitis B infection status. It is a protein found on the outer surface of the hepatitis B virus, and if it's present in blood, it indicates that a person has hepatitis B infection. So now, to understand what the bepirovirsen studies were trying to look into, we should ask ourselves first, well, what is functional cure of hepatitis B? And thankfully, Chari already defined this for us earlier. So just to review what she mentioned earlier, functional cure means that the hepatitis B DNA test remains undetectable or unquantifiable in the blood. Number two, the hepatitis B surface antigen test is undetectable in the blood. And number three, a person needs to be off treatment or medicine for hepatitis B, and that person needs to have this unquantifiable or undetectable Hep B DNA and undetectable hepatitis B surface antigen for 24 weeks or more after they stop their treatment for hepatitis B. Now, what could this mean for a person living with chronic Hep B? Well, a person living with chronic Hep B who achieves functional cure can possibly stop taking antiviral medicine. However, functional cure does not completely remove all traces of hepatitis B in the liver. And when the immune system is weakened, for example, if a person needs to take an immunosuppressant medicine for another condition, it is possible for the body to lose control over the virus, and hepatitis B DNA or surface antigen in blood may potentially appear. Now, these are some of the potential benefits of functional cure of chronic hepatitis B for people. So the first is it lowers the risk of the long-term complications of liver disease, such as liver cancer. Second, I'm grateful for Dr. Cohen for presenting the survey earlier on what functional cure means for people. Second is that functional cure may lessen the stigma of having hepatitis B and the worry of transmitting the virus to others. Third, it may be possible for people to avoid long-term treatment with medicine and long-term monitoring with blood tests. And fourth, functional cure may support recovery of the immune system to help the body control and clear hepatitis B in the liver. So there are two approved treatments for FDA-approved treatments for chronic hepatitis B. One comprised a group of medicines called nucleoside or nucleotide analogs, also known as NA medicines. These are pills taken daily, often for many years. The other is pegylated interferon, and these are injections that are taken weekly for approximately a year. Interferon is rarely used in the US at present due to side effects. On the other hand, side effects from NA medicines are uncommon and mild, and NAs, but also interferon, are also able to lower hepatitis B DNA in blood to low or undetectable levels. NAs are taken for many years. Stopping treatment with NAs may cause the hepatitis B virus to start multiplying again, which can cause an increase in hepatitis B DNA in blood or also liver inflammation. Now, what happens after 1 year of treatment with NAs? The chance of having undetectable surface antigen is less than 1%. And for interferon, the chances of having undetectable surface antigen after about 1 year of treatment is about 2 to 8%. Now, in the next slides, I'm going over the BeWell study and its findings. So bepirovirsen is the name of the medicine that was evaluated in the BeWell studies. So bepirovirsen, it's a medicine that targets the molecular blueprints used by the hepatitis B virus to reproduce and build viral proteins. Now, how did participants in the BeWell studies take bepirovirsen? Now, the medicine was taken as 2 injections under the skin every week. Now, in the first 2 weeks, additional injections were given as what we call loading doses. Now, a loading dose, this is a larger than normal dose of a medicine that is taken during the start of treatment in order to more quickly raise the drug's levels in the blood. Now, people in the study, the Be Well studies, took bepirovirsen for 24 weeks, and they also continued taking their NA medicines while they were taking bepirovirsen. Now, what was the purpose of the Be Well studies? So the studies looked at whether bepirovirsen can help people living with chronic hepatitis B achieve functional cure. Now, in the studies, 1,224 people received bepirovirsen, while 614 people took placebo over 24 weeks. Placebo looks like the real medicine, but it does not actually contain the active medicine. It just looks like it. And placebo helps researchers in showing that any effects due to bepirovirsen are due to the medicine itself instead of from other factors. Now, what did the researchers measure between the bepirovirsen and placebo groups? So the researchers wanted to determine what percentage of people achieve functional cure if they receive bepirovirsen compared to if they receive placebo for 24 weeks. Now, I'd like to go over next the design of the study, and I'll try to make this as simple and as easy to understand as possible. And I think this is important to understand, what happened or what the participants of the Be Well studies underwent during the studies. So study participants were randomly assigned to receive either bepirovirsen or placebo. The study was designed such that for every 2 people receiving bepirovirsen, 1 person receives placebo. Now, for the first 24 weeks, people received bepirovirsen or placebo injections together with their NA medicines. Now, after completing 24 weeks of injections, they continued taking their NA pills or NA medicines only. Now, after another 24 weeks or at the 48 week, people were evaluated if they can stop taking their NA medicines. And so hepatitis B virus levels and other lab tests were obtained. And in order to stop taking their NA medicines, a person must have both their hepatitis B DNA and hepatitis B surface antigen undetectable. Another hepatitis B protein in blood called the E antigen should also be undetectable. And there needs to be minimal liver inflammation, which means that the ALT test of the blood must be low or normal. Now, for the next 24 weeks or from week 48 to 72, people either stop taking all their hepatitis B medicine, including their NA, or they continue taking their NA medicine, depending on whether they meet the criteria for stopping. People who were able to stop taking their NA medicine were assessed for functional cure after 24 weeks, or that is about week 72 since they started everything. And then they were also monitored for an additional 24 weeks. Now, if you would recall the definition of functional cure that we discussed earlier, people who were unable to stop taking their NA medicine because of the lab results, by definition, have not achieved functional cure because at week 72, they're still taking their medicine. So a person living with chronic hepatitis B can join the Be Well study if they have surface antigen levels between 100 and 3,000. They were already taking NA medicine for hepatitis B and had low levels of hepatitis B DNA in their blood. They have little to no liver inflammation based on their ALT, and they did not have severe liver scarring or liver cirrhosis. Overall, more than 1,800 people from 29 countries participated in the Be Well studies. So on average, the study participant who took bepirovirsen is about 50 years of age, 73% were male, and 27% were female, 68% were Asian, 26% were white, and 5% were Black. Now, if we recall, participants must have surface antigen between 100 and 3,000. So about 2/3 of people who took bepirovirsen had surface antigen between the lower range of 100 and 1,000, while about 1/3 had levels between the higher range of 1,000 and 3,000. And over 98% of the participants had undetectable hepatitis B DNA at the start of the study. So how many people had hepatitis B blood tests that allow them to stop taking their NA medicine? So this is data from combined B-Well and 2 studies. And here we see that 24% of people who took bepirovirsen were able to stop taking their NA medicines. Now, in people who took bepirovirsen and have lower surface antigen of less than 1,000, 31 to 33% were able to stop taking their NA medicines. Of the people who received placebo only, no one was able to stop taking NA medicine. Now, this is the main finding of the studies next. So how many people achieved functional cure? So again, let's review. Functional cure means that a person has stopped taking all their medicine for hepatitis B, and their hepatitis B surface antigen and hepatitis B DNA are both undetectable for 24 weeks or more after they stop taking their hepatitis B medicine. So in this study, 19% of people, or about 1 in 5 people who took bepirovirsen achieved functional cure. If we look at people who took bepirovirsen with the lower surface antigen level of less than 1,000, about 26%, or about 1 in 4 people, achieved functional cure. And if we looked at the people who received placebo only, no one was able to stop taking NA medicine and no one was able to achieve functional cure. Now, what were the side effects experienced by people receiving bepirovirsen? So these are combined findings from people in the B-Well 1 and 2 studies who took bepirovirsen. So when we talk about side effects or adverse reactions, so these are events that the study doctor thinks may have been caused by the study medicine. The most common side effect of bepirovirsen includes symptoms felt at the site where the person injected themselves with the drug. So these symptoms include redness, pain, itching, or bruising. 14 to 31% of people who took bepirovirsen experienced one or many of these side effects. And 1 to 5% of people who took placebo injections experienced these side effects. 22% of persons who took bepirovirsen had an increase in blood ALT levels compared to 3% in placebo. 19% of persons who took bepirovirsen had a fever or felt feverish compared to 3% with placebo. And 15% of those who took bepirovirsen had a decrease in blood platelet counts compared to less than 1% in placebo. Now, side effects are considered serious in the study if they require hospitalization, if they cause lasting problems or disability, or if they are life-threatening or cause death. Serious side effects related to bepirovirsen occurred in 2% compared to none in placebo. Now, when some side effects or abnormal blood tests reach a certain level or severity, the study doctor may pause or permanently stop the medicine. 16% of people who took bepirovirsen had side effects that needed a hold in their treatment. 3% who took bepirovirsen had side effects that led to permanent discontinuation of the drug. All right. Now, the drug class of bepirovirsen has some specific side effects that show up as abnormalities in blood tests. And these blood tests were monitored closely in the B-Well studies through regular lab testing. So these tests are blood tests for liver function, kidney function, and platelets, and additionally, a urine test for kidney function. For the first 24 weeks, tests of liver function were monitored weekly, urine tests every other week, and platelet tests weekly. For the next 24 weeks, tests are taken about monthly. And for the next 24 to 48 weeks, for the next 24 to 48 weeks, which is to say between week 48 and 96, only tests of liver function were monitored in the studies at a frequency of every other week to monthly. Now, the aim of these lab tests was early detection of potential lab abnormalities so that the study doctor can prevent more serious side effects from occurring by monitoring the person more frequently, by temporarily holding the drug, or in some cases, even stopping the treatment. And so, in summary, what did we learn today? First is that chronic hepatitis B can cause serious liver damage over time. Second, current medicines used to treat hepatitis B are often taken for many years because the hepatitis B virus can start multiplying again, and they rarely stop production of hepatitis B surface antigen, or HBsAg. Third, the goal of the B-Well studies was to test whether a new investigational medicine called bepirovirsen could help achieve functional cure of chronic hepatitis B. Fourth, B-Well researchers also looked at the side effects of bepirovirsen. Five, the B-Well studies showed that bepirovirsen achieved functional cure in about 1 in 5 study participants with chronic hepatitis B, and if their surface antigen level is less than 3,000. And lastly, bepirovirsen was tolerated by many participants. The most common side effects were irritation or discomfort at the site of injection, fever, increase in ALT blood tests, or decrease in platelet count. And these side effects were consistent with what we know about the safety profile of bepirovirsen from earlier studies. And that's my last slide today.
Thank you, Dr. Esteban.
You are very welcome.
I'm gonna remove. If I could ask you to stop sharing, please, and we'll get Justin pulled up. As that's happening, I was just gonna make one single note, which was so you mentioned 3% of folks on Bepi had a side effect leading to permanent discontinuation of treatment, and just in case pegylated interferon is something that's been around 20 plus years now. And in case folks don't know what the discontinue rate is because of adverse effects on that, it's actually between 7 and 14%. So just to give a little bit of a comparison, a lot of folks who know the PEG interferon days are like, those were bad days, and it's like, yes, this is not even close to those levels. So very exciting to see that adverse effects is impacting such a small number of folks. After two really great presentations, we're going to turn it over to Justin Chen to bring us home. Thank you for those who've been dropping questions in the chat. Keep doing so, please. We will tackle those when Justin's done. And I see your slides, and I think you're getting them into full screen. There you go. And I'll turn it over to you, Justin. Take it away.
Thank you. Hi, everyone. My name is Justin, and I'll be talking a bit about how the Hep B functional cure will impact community outreach and linkage to care and treatment today. Just want to give a quick background. Okay, there you go. Just want to give a quick background about where I'm from. I'm a population health program coordinator from Charles B. Wang Community Health Center, which is an FQHC located in New York City. We currently have 5 sites, 2 in Chinatown, Manhattan, 3 in Flushing, Queens, and we provide a number of services for patients such as internal medicine, pediatrics, OBGYN, and these other services that I'm not going to read out. Okay. And then currently our health center has 2 Hep B programs, the Hep B Care program, where we provide care coordination for high-risk chronic patients. We also provide education about patients' current Hep B status and try to get their contacts tested. And we also offer free liver cancer screenings for eligible patients and try to enroll uninsured patients into free or low-cost antiviral treatment options. For our Hep B Moms initiative, we try to provide care coordination for Hep B positive pregnant patients, and we also educate about antiviral treatments. We also try to get their contacts tested and try to vaccinate their babies to prevent vertical transmission. And we also track the vaccination records of babies. In addition to those 2 programs, we do try to eliminate Hep B in different ways, such as providing universal screening for internal medicine patients. We also act as a referral site for our partnering organizations, and we also offer free or affordable vaccinations for uninsured patients, as well as discounted liver cancer screenings, such as FibroScans, CTs, elastographies. And we also offer free multilingual health education resources and free screening for community members. Our health center, every year, we're also heavily invested in community outreach and advocacy to eliminate Hep B. So how will functional cure impact community outreach? Well, one, we will definitely see an increase in screening interest. We will also see a reduction in Hep B related stigma. For the increase in screening interest, people might want to learn more about their Hep B status and if they're eligible for the functional cure. For the Hep B related stigma, the functional cure does change the treatment discussion, since Hep B is now going to be much more manageable, and people might be more encouraged to get tested. And one thing that's really nice is that our Hep B programs are very strong, and we already are equipped to handle the increase in screening interests, or inquiries about the functional cure. One of them being that we have culturally and linguistically appropriate education services. So to break down the concept of Hep B and maybe help break down the concept of the functional cure when it comes out. We also have trusted community presence. We're always in the community, whether it be participating in community health fairs or reaching out to religious institutions to get people tested. And by having this trust, we actually make it easy for people to screen with us and also maybe get the functional cure through us. And also, we offer free or low-cost screening, which is really nice in eliminating that financial barrier for patients to know about their Hep B status. And also, this free screening also leads to connecting to care at different places. And now, some challenges associated with community outreach is essentially the new stigma that may come from those who do not qualify or achieve the functional cure. Individuals might feel like they're not worth treating if they don't achieve the functional cure or can't get it. And some recommendations for us to address this is actually to develop supportive messaging, making sure that we say that ineligible people or people who can't get the functional cure doesn't mean that they can't live a normal life. They can still do that with the existing treatments. Also, we can avoid overselling the functional cure benefits. If people just hear about the benefits and not the limitations, they won't be disappointed. And also just normalize existing treatments again. Our current medications and continuing to follow up with providers is just as good enough with preventing further liver complications caused by Hep B. And how will functional cure impact linkage to care? We will definitely see a return of patients lost to follow-up, especially those who are interested in learning about their eligibility for the functional cure treatment. We also might see better adherence to care, especially amongst individuals who can't qualify for that functional cure at the moment and might want to see if they can qualify for it in the near future. We also might see lower long-term caseloads, especially as those who achieve the functional cure. And one thing that's really nice about our current Hep B programs is that we actually have the infrastructure to deal with the increased the workload that comes with care management and linkage to care, such as the robust patient navigation and care management system. We also offer affordable or low-cost care, which eliminates that financial barrier for patients. We also have a strong referral and follow-up workflow. So patients have that continuity care. And in terms of challenges, I would say that the biggest challenge would probably be the increased workload for patient navigators and care managers. And also staffing shortages doesn't help with the workload, especially if you have to, navigate and care manage patients who are eligible and ineligible for the functional cure treatment. And another challenge is the referral drop-offs. People who lose drop off of the referral process. It's going to take extra work for the care managers and patient navigators to bring them back in and try to continue their care. And some recommendations to address this would be to create patient navigation and care management roles. And if that's not possible, to make sure that the patient navigators and care managers can share the responsibilities. Another is to build partnerships to fill gaps in care. So, for example, if you're an organization that is not unable to hold the treatment on site, but you know that somebody else can create that partnership with them so that your patients that you work with can have access. to that functional cure treatment. And then another thing is to create warm handoffs with referral sites. And this includes making sure that patients get their appointments scheduled before leaving you, and then making sure that the patient knows who they'll be seeing at that referral site and being proactive about that reminders for their treatment. And in terms of treatment, it's the functional cure will definitely shift the treatment discussion from uh, it will actually shift the treatment discussion from long-term management to more so of a question about affordability, eligibility, and whether they're able to, commit to that treatment. And as we've heard earlier, the functional cure does have a large commitment, 2 injections per week for 5.5 months becomes 44 injections. And at the same time, the patient has to be on antivirals for at least 11 months. And there might be weekly blood work to check their liver functions. And one thing that's nice again about our current Hep B programs is that we have the infrastructure to deal with the intensive regimen, such as providing affordable or low-cost labs. Care managers can even enroll patients into the patient assistance programs to make sure that they continue to have medications during this process, or they can also refer patients to get their medications from 340B pharmacies. And one note that I want to say about the 340B pharmacies is that the money that facilities can get from the 340B pharmacies can be reinvested into non-billable services, such as free screenings for people to determine whether they're eligible for the treatment. And it also could be used to expand the patient navigator and care manager workforce. And another existing strength would be the reminder and scheduling support. I know a lot of our programs today have staff who call patients and make sure that they come to their appointments. And that's really helpful for a long-term treatment course. And in terms of challenges, I would definitely say the biggest one is treatment access and affordability. For the underinsured patients and uninsured patients, they're going to have the hardest time if their treatment isn't covered or the increased clinical visits isn't covered. Another thing would be the care continuity for transient patients. So as we all know, vulnerable patients don't stay in one place for too long due to work. And as a result, they might experience barriers to getting the functional cure. And another thing would be treatment hesitancy. Ever since COVID-19 pandemic and also the recent discussions about the Hep B birth dose, I feel like there's been a lot of hesitancy around injections, and I'm sure this is going to be the same around a novel injection-based treatment. And in terms of recommendations to combat these challenges, I would definitely incorporate insurance navigation into the workflow to make sure that patients who lose their insurance during the process can, be get their insurance back on again as soon as possible. I would also utilize automated reminders to make sure that patients come to their appointments. It's really unrealistic for care managers to call a patient every week if the patient is supposed to come back every week for that treatment. And I would also develop educational materials about commitment, benefits, and risks about the functional cure, so that the patient has all the information about the functional cure and can make that decision themselves on whether it's best for them. So I know that I've spoken a lot, and I just want to provide some key takeaways. I just want to say that our Hep B programs currently have strong existing infrastructure to handle the workload that comes with the functional cure. Our patient engagement remains essential, especially for those who are ineligible or can't achieve that functional cure. We still have to make sure that patients get the care that they need and stay on top of their medications. And stigma and misconceptions must be addressed. The functional cure may decrease some stigma that's already exists, but it does not eliminate it at all. And there's also might be new stigma that comes from it. And so our educational efforts are really important in addressing those. And the last point is that the functional cure is only impactful when barriers to testing, treatment, and follow-up are reduced. And that's about it.
Thank you very much.